Dr. Sean Chu here, Loft19. We're going to do 2 implants today. One implant is going to be done on the top where it's going to be affecting the sinus. So we need to do a sinus lift, and we're going to walk you through it on the top of placing the implant in that area. Now we can't just place an implant in the area because the sinus is really near, so we got to be careful. And we use a special hydraulic system to lift the sinus membrane up gently, pack bone in the area while we place the implant simultaneously. And then the bottom, we're going to also place just an implant in the area where there's a missing tooth. So here's a CBCT X-ray scan. You can tell the proposed implant is going to be placed inside the top, and it's going to go right into the sinus. So we need to lift the sinus membrane very gently in the right area while placing the implant so that the implant doesn't perforate into the sinus. So we're going to do a simultaneous sinus lift with bone graft and place the implant on the top. And then on the bottom, it's quite straightforward. We'll just be placing an implant into the bone, basically. Surgical guide that's been made, 3D digital printed surgical guide using both 3D X-ray and a scan of the mouth, and it's going to allow us to place the implant at the perfect angulation. See the little hole here? It's going to be placing, we're going to place the implant here when ready at the perfect angulation, so there's no guessing game. This is a hydraulic system. We're using saline. We're going to push it in, this syringe of saline solution, into the area where we drilled, and it should tunnel in. The water should, pressure difference should lift the sinus very gently. And once the sinus is lifted with this sinus lifting mechanism, with using a saline hydraulic system, then we're going to pack bone in there gently and then place the implant. Here we go. This is the packer. I'm going to pack the bone in. Pick it up. This is nickel titanium. It's a very high quality implant. What first I'm going to do is I'm going to place it in plasma machine to coat it with plasma, and that increases the chance that it'll bond. Here we go.
Starting activation.
See the layout? It's a nice print. This is the stent that's going to guide us right in. Implant's going in now. Here we go. Looks good. Implant was successfully placed. I'm going to put a cap on top of it now. PTFE sutures are high-end sutures. The most important part of the surgery, the suturing technique, that's the most important. This will determine how the soft tissue is going to heal up on top of that area. Looking beautiful. Wow, that's looking great. It's looking great. That, ladies and gentlemen, concludes the top implant. Just placed an implant in, did a sinus lift. Okay, we're going to do the implant now for the bottom. Go 3.8, 16. Yeah. Now we're going to use 2 lasers now as an extra supplemental step, which sets our office apart, and a lot of offices with implants is disinfection. So we use this to clean the hole before we place the second laser. This is the second laser, neodymium ND. Disinfection is done. The laser. Okay, implant placement now. Here we go, folks. So that last implant sometimes is a bit big for the size. The experience of a surgeon is able to determine what's a better fit size for the implant, ad lib right then and there. So we're going to determine what's the best fit and what's going to work the best for them. Even though we plan for a larger size implant for diameter, we're going to try now with a smaller size implant. Very good. I can probably a couple more strokes. So we have a machine now to test the stability of the implant in the bone. Sometimes the implant bonds in tighter than other times. We have a machine to determine how stable that implant is in the bone. So we'll show you. It's called the ISQ reader. This was a surgical test. process, ladies and gentlemen. Make sure to floss, boys and girls, to prevent a lot of future problems happening. Place it near 79, 78, 85, 85. So ISQ is pretty stable. We're good. We're Gucci, boys and girls. I'm gonna place that PRF right under that. Can you give me a piece of thin PRF?
Did you know that PRF stands for platelet-rich fibers?
Wow. Are you the doctor now? And let's poke a hole in it, and we'll use that PRF to cover over it and screw it on top, stitch it up, we're all done. See? That's gonna be the cover, PRF on top of a screw. Beautiful. Gonna tuck it under the gums here and start the stitching process. 15 years of schooling, ladies and gentlemen. That's what I do in a day in, day out. Welcome to my world, the life of Dr. Chu. This is my bread and butter. This is what I usually do day in, day out. At the end of the day, we're bettering the quality of life of this individual. He's gonna get his tooth or 2 teeth back, whereas they may not able to chew for so many years. It's like a miracle, you know, being able to give someone their tooth back. It's an absolute honor and pleasure to be able to work hand in hand with patients, help them have a way better life. Let's do some glue stitch. This is the final piece of the puzzle, ladies and gents. It's what we call glue stitch. It looks purple, it's very liquidy. Once it touches the blood, it hardens and reinforces like our stitches that we place. We're done, ladies and gentlemen. That concludes my surgery. That was a surgical success. I'm going to take a CBCT x-ray now, make sure everything is in there, is in place. I'm going to prescribe some antibiotics for this patient, some painkillers, some antibacterial Motrin. Good to go. 3 weeks time, I'm going to get the stitches out. 6 months from today, take a new x-ray, make sure everything's good. Then we're going to restore it with 2 teeth. He's going to get his teeth back. I'm excited. Like, follow, comment, share, and be sure to follow us. If there's any other things that the patients like to see more of, let us know in the comment section below.